Hello, my name is Karan Diwan. I'm a consultant in restorative dentistry at the Birmingham Dental Hospital and an honorary clinical lecturer at the University of Birmingham. The novel coronavirus pandemic has become a real challenge for healthcare providers around the world and has significantly affected the dental professionals in practices, hospitals, universities, and research institutions. Although the coronavirus pandemic has caused many challenges for the provision of clinical dentistry, we dental professionals have an opportunity to take this positively and enhance our skills, our understanding, and adopt our practices that is safe to us as operators, our dental team, and very importantly for our patients. To get back to doing dentistry that we love, we as dentists will be incorporating rubber dam isolation not just for endodontic procedures but for general restorative work in our day-to-day practices that will require an aerosol generating procedure. In this video, I will talk about rubber dam isolation and various techniques and its uses that you could effectively employ as per different clinical scenarios. As such, rubber dam was introduced back in 1864 by Sanford Christie Branham from New York, and the method of application was introduced back by Dr. Hodgson in 1870. The aim was to ensure appropriate dryness of the teeth is achieved, isolating one or more teeth from oral environment and preventing pulpal contamination from oral fluids. The rubber dam application in the last decade or more is not limited to endodontics, but used very commonly to provide good quality adhesive dentistry and also used widely for other restorative work. The main advantages being a dry, clean operating feel is achieved, isolating the tooth from saliva, blood, and gingival exudates. Clinically, we will be able to achieve better outcomes in endodontic treatments, and bonding for resin-based material would be better and more effective. For an operator, there is improved access and visibility. We are able to appreciate improved properties of dental materials and improves our operating efficiency. But the main advantage being patient safety, and in the COVID era, this would be one of our personal protective equipment, in particular for the aerosol generating dental procedures. Historically, the disadvantages that are reported are increased clinical time, some patient objecting its use, costs, difficulties in placement of rubber dam in an extremely malpositioned tooth, a broken down tooth, or in crowding or in a crowded arch. We should see this as a challenge, not as such disadvantage, as with practice and training you will be able to get the speed, and there are various techniques and strategies that one could use to overcome such different and challenging circumstances. I will be demonstrating some videos and techniques so that you are able to employ that in your day-to-day practice. There are three main goals of isolation. Number one is to gain moisture control. Number two is to have better access and retraction of gingival tissues. And number three, and the most importantly, is to prevent harm. So this is a usual rubber dam kit which I always keep out as a checklist. The first thing which I'm going to talk about is the rubber dam material. The rubber dam material can be classified based on its thickness. It is either thin, medium, heavy, or you can call it thick or an extra heavy. Based on the thickness, on the thinness of the material and what we want to achieve in our isolation, we aim to use that type of material. For example, the more thickness we have in the material, we will be able to get better tissue retraction. However, if we feel a patient has a difficult mouth opening or someone who we are finding it very difficult to place a rubber dam, you might want to have a more tear resistant ones. But in my experience, I believe the thick ones provide better quality isolation, and you can camouflage the tissue resistance by having perforations at the right place. What we also got here is a rubber dam punch. As you can see, there are different gauge starting from the posterior molar area, then moving towards the premolar area, and then anteriorly. We got the rubber dam forceps, rubber dam frame, and this again could be either metallic or plastic. I tend to prefer the metal ones, but at the moment we've got the plastic ones in this tray. We got the floss. Again, we prefer to use a waxed floss which is round, so that we are able to, or your nurse is able to interdentally pass through the teeth easily. And also we use the floss to produce floss ties for retraction purposes. We got the scissors to cut the dam for nasal relief. We got the flat plastic. This is for rubber dam inversion. PTFE tape I use quite a lot. This is used for giving me isolation below the gingival tissue. Vegettes, retraction cords, rubber dam clamps, Vaseline to place underneath the rubber dam so that it helps smoothen the rubber dam and in your placement. And we've got Aura Seal, or you could use a resin based seal material called Liquidam. Selection of clamp is hugely important and is one of the most important part of rubber dam isolation. So what we have here is series of different types of clamps based on the materials. The majority of the clamps in the market, you will see the stainless steel clamps, and then you also got the black clamp, which is black oxide, which is heat treated stainless steel, which gives a better fracture resistance. We also got some clamps based on the location. So if you see the beaks, we got clamps for molar area, and then we got the premolar clamps, and we also got one anterior butterfly clamp here. What is also important to note, if you look at this clamp here, this is a bit raised, so this clamp is for a tooth which is partially erupted. It gives a bit better grip and angulation, and it's lot more active and put a lot of pressure on the tooth as such. You will use a serrated clamp based on if the tooth you are treating has a fractured restoration subgingival and you want a better grip on the tooth. If you note, it has a wider circumference and a smaller circumference. The wider circumference will always go at the buccal aspect, and the smaller circumference will go at the lingual aspect. We got clamp classification based on whether it has wings or it could be wingless. The wing clamps are used often when we are employing a technique where we take the clamp along with the rubber dam together and placing it in one go. The wingless clamp, you use the technique when you are placing the clamp by itself on the tooth first, and then you're sliding the rubber dam sheet afterwards. The advantage of using the wingless technique is that you will be able to see the tooth which you're isolating and you get better access. I tend to prefer the wingless clamp for root canal treatment, because I will be able to get access on the tooth first and then I will be able to slide the rubber dam later. So when you are selecting a molar clamp, if you look at the two different clamps here, they are exactly the same clamp, but they have a wider width between the prongs. And the reason why we have a wider width is because this clamp has been overused and it is totally non-functional from my perspective. You have to be very carefully select your clamp. So if you find something like this in your checklist, you need to discard that, because this is not going to provide you a good isolation. What you're looking for in a passive state, the clamps are very close in proximity. So if you got something a bit twisted, I will discard it. So this is a molar clamp, and if I explain the different components of a clamp, the first thing is the bracket. So this is a bracket. It based on the bracket thickness and its width, the stability of the clamp. What you're looking for a good stable clamp, that they have a good adequate thickness and they are a bit more robust. So the first component is a bracket. What we've also got is a central wing, an anterior wing. The reason why we have this anterior wing here is because it allows separation of the rubber dam coming closer towards the tooth contour, so that you are able to isolate the tooth a bit better. And what we got is a perforation here as well. So the four parts of the clamp are bracket, central wing, anterior wing and perforation. Right, so when the clamp is in situ on the tooth, just for demonstration purposes, what you are looking for is you are looking for 4-point contact. 4-point contact. This will provide a good stable clamp, and the contact should be in such a way where it is gripping to the maximum contour of the tooth. If, for example, this prong is too far forward, it will interfere with placement of your rubber dam and it will cause some tear. If these prongs are too small, then it will ping off. So it is vitally important when you're selecting a clamp, you are focusing on the contour of the tooth and then looking into your clamp collection to see which clamp is going to fit the best contour of the tooth. It is important that you focus on the cervical area of the tooth where you're placing the clamp. You don't place the clamp on the coronal aspect, you place the clamp in the cervical area. So that's where you want to get the 4-point contact. So selection of clamp based on the maximum contour is hugely important. So dental floss. Dental floss is hugely important part of rubber dam isolation. I tend to prefer a floss which is waxed because it is easy to go through interdentally, and also what you want is a round dental floss rather than a flat one, because the round dental floss is able to separate the tooth interdentally. Okay, so a round waxed dental floss is the one which you want to choose. I'm going to show you a technique how to create floss ties, or also called as floss ligatures, for retraction. For example, if you see this model here, we got upper 5 to 5 isolation for composite work or for veneer preparation, for example, and we've got the floss ties which are tied towards the rubber dam frame. This model is for maxillary anterior region, and if you look at the rubber dam frame, you can invert the rubber dam frame in such a way. It's an inverted U-shaped use of the rubber dam frame rather than the usual U-shape which we tend to use. Okay, so I'm going to show you the technique of how to tie in the floss ties. So that's dental floss. I'm going to demonstrate how to tie in a floss tie, or a floss ligature you can call it. So we got a floss which is about 15 to 20 centimeter in length. What you need to do is to have the loop end on one side and the free end on the other side. Okay, so with your thumb and your first index finger, you invert that and you will see a shape like a scissor, and with your other finger you pull this, and then you use your first index finger and go through the loop, and with your second index finger you also go through the space you've got and create the first tie-in. Okay, and what you do then is you go back again with your thumb and your index finger, and you do the second tie-in with the same technique, and your index finger is going back again, and here you go, you got your tie-in. This is again so real speed. So what you got takes few seconds. A dental nurse is a vital part of our work on a day-to-day practice. Today we've got Laurie, who is one of our DCT in Restorative, who has very kindly agreed to be part of the demonstrations. Moving forward, we have to maximize our own efficiencies utilizing the skill set of our dental nurse in a four-handed way, so that we are able to be more effective and have better outcomes and quicker outcomes. So basically we are going to be talking about rubber dam isolation for a maxillary anterior area, and the technique I'm going to be talking about is a split dam technique, where we are trying to isolate upper right 3 to upper left 3 for various restorative procedures such as veneer preps. First thing first, we're going to place the rubber dam, identify where we have to make the holes. So in this situation, we are going to make the holes from upper right 3 to upper left 3, and I tend to make the marks on the center of the tooth. I will then punch the holes. It has to be a clean punch hole, making sure you are able to use the nurse as a support, and I'll join the two dots of the hole from 3 to 3, and this is the split which I have created, and I will then place it on top of the anterior area, and I'm going to put some vegettes, or you could also use part of the rubber dam material itself. This technique is very useful for restorative procedures such as preps and restorations, composite work. You could use a caulking agent plately so that there is isolation, and I tend to use a cotton pledget, a wet cotton pledget with the tweezer, and I just pat it out so that it's all sealed properly. I will not place the caulking agent anteriorly because we are going to be having the suction in the anterior area where your nurse is going to be holding that. And put the rubber dam frame, and now this area is isolated. So this technique is for isolating a quadrant, and again you could use this technique while you, for example, you're doing restorative work like amalgam restoration or composite work. I tend to isolate the whole quadrant because it gives you a lot bigger space and it gives you more effective isolation. And in this technique I will demonstrate to you how this could be achieved. So again, firstly, numb the patient up, ensuring when the patient is being numbed up, you are talking to the patient, explaining the procedure. In this technique I'm going to again show you that we are going to floss the interdental area, making sure your rubber dam can pass through smoothly. If you find that the floss doesn't go smoothly at this stage, you could improve the interproximal area by through interdental stripping or by smoothing the area or the default. Again, you're going to choose the rubber dam, and also the position of the rubber dam is important. And I'm going to mark which tooth I'm going to be isolating. So if, for example, if I'm doing a restoration in the upper right 5, I will isolate the distal tooth, which is upper right 6, upper right 5 till the upper right 1. My clamp is going to go on the upper right 6, but I'm able to do restorative work also on the upper right 5. Your nurse is helping you out while you're making the punch, and the correct size of the punch needs to be made, and it has to be a very clear punch so that there is no tear. So once the punch has been made, you could use a Vaseline underneath the surface of the punch, again, which helps to place the rubber dam more easily. And you also have to change the gauge of the punch hole, ensuring that you have the right gauge. If you have the gauge which is slightly larger, you will not get a correct isolation. So it is paramount that you don't rush this aspect of making a punch. I'm going to show you how to put the clamp. We're using a wing clamp. Once the clamp has been placed, you are going to check for its stability. It should have a 4-point contact. If it is moving, then you have to ensure that you use the correct shape of the clamp. 4 points contact have been checked. Ensuring that the rubber dam is stretched properly with both your fingers, and it goes through the bow and the entire clamp easily. And if you do get a tear at this stage, I would suggest you redo the whole process of selecting the new rubber dam rather than using the old one. What sometimes helps, if you have the cheeks and the lips coming in your way, you can put a cotton wool roll in the sulcus, which sometimes helps to retract the tissues. Go back again with your floss, and it is a trick where you don't pull the floss upwards, you just pass it through so that it does not take the rubber dam along with it. I'm going to use a flat plastic to ensure there are no spaces, and it could be sometimes tricky, and that depends on the anatomy of the tooth, that you get the rubber dam sticking to the distal aspect of the isolated tooth. What you could do then is to use your rubber dam forceps and dislodge, and I would say release the clamp gently, and while you're doing that, you will see the rubber dam sheet will slip through interdentally, especially if you choose more heavy type of rubber dam material, and that is the choice of the material I tend to prefer. But for this demonstration we have the more elastic ones, and I'm going to then use the wedgets. Can also use part of the rubber dam itself as part of the isolation, and then we can have the frame being placed on top. Again, I prefer a frame which is metal because it gets me better grip. The plastic ones tends to, over period of time, they tend to be non-functional. What I do then is I use my flat plastic to retract the rubber dam material in the sulcus. I would suggest you need to do that in every case. I'm just releasing the clamp a bit to make sure that the rubber dam slips through between the spaces. And I'm just showing a nasal relief if the patient happens to be not able to get a free airway. So that's an isolation, a quadrant isolation, and you can pretty much do any restoration on the upper right 2, 3, 4, 5, or even an occlusal on the 6, and in fact 1. So it gives you a huge amount of variety of what you could do in your practice, where in one visit, if you are doing an isolation, you can carry out a quadrant work in one visit, ensuring the patient is appropriately numbed and you're checking that the patient has good isolation. I'm going to also show a technique how to remove the rubber dam. You can ask your nurse to pull the rubber dam sheet. When you see that the rubber dam is pulled, you'll see that they are connected interdentally, and you could use a scissor to very gently cut through these tags, and this makes the removal of the rubber dam fairly easy rather than pulling it in a jerk, which can have spillage. To cut the rubber dam before you retrieve the whole clamp out, and if you see any tags, you can cut it through, and then it becomes very easy to remove the entire rubber dam without any spillage. And it will be hugely important during this COVID era where we don't have any splashes. Okay, so this is a technique where we are isolating the maxillary anterior region. It could be used for various restorative work, such as isolation of upper 5 to 5 for veneer preparations. It could also be used for composite bondings. And depending on how much isolation you want, you could do isolation from 3 to 3, or you could do isolation from upper right 5 to upper left 5, or 4 to 4. It does not matter. So in this video, we are doing the isolation from upper right 4 to 4 because the patient had previous orthodontics and she has missing 5s. We select the clamp, we place the clamp, check for its stability. We have already ensured that your nurse has already punched the holes correctly, and then we slowly insert the rubber dam sheet through one of the clamps. The bow comes first, and then you're making sure that it goes through the clamp properly. And while you're doing that, you're ensuring that your other clamp, your clamp is secured always. You could, once you have done that, you do the left side of the arch prior to moving anteriorly, and once you have isolated both the premolars, you will then move to the anterior region. And it is quite useful for your nurse to hold the floss in his or her hand, and while you're isolating the front teeth, she or he could then insert the floss and making sure the interdental dam sheet is adapted properly. So this technique is very useful, and I use that quite a lot for doing composite restorations. Once you have achieved an isolation, you can then place a rubber dam frame. Okay, so once you've secured the clamp and the rubber dam all together, following flossing, what you could also do is to invert the dam, and I use also dental floss to get more retraction. The floss ties, we call it, or floss ligatures, and they are hugely helpful for restorative work. So suppose you have a restoration at the cervical margin, using these floss ties will help enormously. And if you note, the rubber dam frame has been inverted. Unlike the normal U-shaped, it's inverted U-shaped, and for this isolation I tend to invert the dam in this way. So what you need to do, once you have got the floss ties in situ, you could then tie them with the rubber dam frame. Again, you can use as many floss ties as you want to. You can use floss ties, or you could also at some point use PTFE tape if you need to, if you feel that you require that. So in this technique, now what I'm doing here is with my flat plastic, I'm just checking the isolation and inverting the dam in towards the sulcus so that the isolation is pristine. And what I'm going to do now is to tie this floss with the rubber dam frame so that it gives us a good retraction. I'm putting a rubber dam floss tie on upper left 1 and upper left 2 for just demonstration purposes. And with your flat plastic, you could ensure that the palatal aspect of the floss tie is also adapted closely with the cervical margin and it's not loose. This is a technique called the wingless molar single isolation. Always the clamp goes first. Once the clamp is in, the rubber dam frame and the rubber dam goes subsequently. So the advantage of using this technique is that you are able to see the tooth which you're isolating initially. I tend to prefer this technique quite a lot for single isolation, especially for root canal treatments, and it makes much easier accessibility. Now the technique involves selection of the clamp, and it is very important that you select the clamp based and the design of the clamp based on the tooth morphology. Otherwise you will end up having this technique not being successful. So I've placed the clamp, I've then placed the rubber dam on top of the tooth and retracted it, and the same principles goes. You will require flossing. It is important that you don't pull the floss upwards but slide it through side by side so that the floss does not take the sheet along with it. Again, a very useful technique for single tooth isolation, whether it is molar or premolar. And I'm now removing the clamp very gently. The next technique is the winged technique, where you take the clamp along with the rubber dam sheet and then you take it and feed it together on the tooth which you're isolating. If you note, in this technique we've got the floss already there. It is important for patient safety and retrievability of the clamp if it fractures, that you have the floss always, and it's important for the medical legal purpose as well. So once the clamp is in situ, you check for stability, you check for 4-point contact, and ensure then you retract the sheet from the wings to get the isolation you want. Once you have achieved that, you can then similar principles follow here as well. Use the dental floss interdentally to ensure that the dam sheet is adapted very well along the lines of the gingival tissue. Step-by-step procedure for rubber dam isolation is to initially numb the patient. While the patient is being numbed up, you're ensuring that you're communicating with your patient to explain what you're doing, talking to them in a very sensitive way, making sure that you're not using words which are alarming to them, such as rather than saying a rubber dam, you can say a rubber dam sheet, or rather than saying a clamp, which can be quite alarming, you may want to use the word rubber dam sort of a clip. And once the patient is numbed up, you're going to orient your rubber dam sheet to make sure you know where the punch is going to be made. You can use various templates or the technique which was explained previously, using the center of the tooth. Have a very clear-cut punch, making sure you check that there is no tear. Start flossing the teeth, making sure that before you put the rubber dam sheet, that there is enough space between your teeth so that you don't have any problems while you're doing the placement. Use the floss prior to placing the dam. Choosing the right clamp is important. So once you know which tooth needs to be isolated or an area needs to be isolated, making sure you know the anatomy of that tooth very well in your mind, and then choosing the correct rubber dam clamp. If you feel that you need quite a few clamps out, you could do that, and I think it may not be a bad idea having 3 or 4 clamps out. And as you get more experience, you will know which clamp to use for which situations. I always use Vaseline underneath the dam so that it makes the placement of the dam easier. You can then stretch it while you're placing the dam on towards the bow of the clamp or the tooth. Now, once you have isolated the tooth, I tend to then use the floss again to make sure the interdental areas are well neatly inserted, the rubber dam is inserted and closely adapted to the tissues. I also use the flat plastic to ensure that there is inversion of the dam inside the sulcus to give the best isolation you can achieve. And the last thing I will say is you need to be very careful when you're removing the clamp, because you can chip or fracture the tooth which you have restored. So just ensure you have a direct vision while you are doing a removal of the clamp. These techniques are hugely useful in our day-to-day general dental practice work, whether it is a simple amalgam restoration or it could be a composite bonding or veneer preps and onlay restoration. So I hope the presentation was useful, and I wish you all the best.